Our heart is a kingdom of love. It's an embodiment of the force within us. It's our heart that helps us express the voice of the soul. It's our heart that gives us a million reasons to share. It's the heart that fills us with the vigor to live healthy. It's the heart that supports us while we climb towards our dreams. It's the heart that lights up within us the passion to excel. It's the heart that unleashes our spirits to enjoy. And it's the heart that pumps to feel the victory. Our heart is the strength of our family. It's the pursuit of well-being. But what if this heart is no longer as strong? What if a heart failure brings an end to all your happiness? The answer to this dismal question is Dr. H.K. Bali, a man who can help you escape the darkness of death. With his support, you can live a life of independence. The device is called biventricular pacemaker and implantable cardioverter defibrillator. Improve the heart's pumping ability and correct dangerously fast heart rhythm. These heart failure devices have enormous potential to improve the quality of life and survival for patients with heart failure. Dr. H.K. Bali can give you a new hope and can offer a second chance to live. These devices are security blankets which will help you live a normal and a healthy life and will also bring up a hope for a better tomorrow.
जब ये मेरी बीमारी बिल्कुल ठीक नहीं हुई, मैं दर दर भटकता रहा, हर रोज मेरे को हॉस्पिटल के चक्कर काटने पड़े और मैं दूसरे के ऊपर ये सोचा कि मैं आज बोझ बन गया हूँ और मैं जी भी नहीं सकता, तो मैंने जो है अपने आप को बस ये सोच लिया कि इस दुनिया से अलविदा ले लूँ। जीने के लिए मेरा कोई मन नहीं करता था और जो है मैंने मरने के लिए पूरा ठान लिया था अपने मन में कि मैं मर जाऊँ।
मेडिसिन मैंने दिंदे रहे पर मैंने कोई आराम नहीं रहा। हौली हौली मेरी जी प्रॉब्लम है बढ़ती गई तो मेरे शरीर फ्लूइड इकट्ठा होने लग गया। जिस वक्त मैं इत्थे इलाज लिए आया, आई वॉज जस्ट ऑन ए डेथ बेड।
जब मेरे पास मिस्टर राधे श्याम जी आए तो राधे श्याम had been to so many institutes across North India that he had lost count of the hospitals he had been admitted to. You know, his life had become so miserable that he was fed up of his own life. अब आप मिस्टर गोयल की बात करिए। मिस्टर गोयल, when he came to me, he was so bloated. You know, he says that he was 120, but he looked almost 150 kg to me. You know, his eyes were sagging, he could hardly speak. And one question which changed my outlook to patients with heart failure was, he said, डॉक्टर साहब मेरे पास कितने दिन हैं, क्योंकि मैं अपने बच्चों के लिए वसीयत लिखना चाहता हूँ. You know, I thought, you know, something needs to be done for this patient.
Dr. Harinder K. Bali did his MD Medicine from PGI Chandigarh in 1985. He was awarded Kataria Memorial Gold Medal, the highest academic award of PGI, for being the best postgraduate of the year 1985. In 1990, he was awarded the D.P. Basu Award by the Cardiological Society of India for being the Young Investigator of the Year. Dr. Bali served PGI as additional professor for more than 25 years, and presently he is working as Director Cardiology at the Fortis Hospital, Mohali. His work has been appreciated at a number of international conferences worldwide. He has been international guest faculty at more than 20 international interventional conferences. Dr. Bali was the first to show the efficacy of stenting for management of patients with Takayasu's arteritis, and his work is always quoted in many publications on this subject. We aspire to ease you from the dreadful symptoms of heart diseases and assure you a prolonged life with better quality of life.
There are a lot of poor people out there suffering from heart disease. Now, these people do not have access to the state-of-art treatment. We are making progress in diagnosing more and more heart disease. We are making progress in treatment options being available to people. We are making significant improvement in using technology for improving the health of these patients. So my mission, the mission of my team, is to offer this technology to a wide spectrum of patients, the poor and the middle class people, at an affordable rate. So the technological advances which are taking place across the world can reach the common man.
Our pursuit is to accord with the new era technologies and upgrade ourselves so as to achieve a next level expertise. We aim to revolutionize the medical advancement and leave marks for the rest of the world to follow. Newer technology must reach the common man and make a difference to his life. More than 22 million people worldwide suffer from congestive heart failure. Until recently, medications and heart transplant surgery were the only treatment options. Heart transplant, unfortunately, is not available to everyone. Because of lack of sufficient donors, patients with severe heart failure continue to remain symptomatic despite maximally tolerated drugs, and they require repeated hospitalization. To make matters worse, up to 40% of patients with CHF also have arrhythmia that can be life-threatening, and they also worsen heart failure.
2007 में मैं अपनी बीमारी से दोबारा इतना तंग आ चुका था कि मैं जो है कभी पानीपत में, कभी दिल्ली में, कभी मेट्रो हॉस्पिटल में, कभी पीजीआई चंडीगढ़ में दाखिल रहा। दाखिल रहने के बाद 2-4 दिन दाखिल रहता है, फिर उसके बाद छुट्टी हो जाती है।
जब इनको ये प्रॉब्लम दोबारा शुरू हुई 2 साल पहले, तो इनको पानी इकट्ठा हो जाता था शरीर में, और उस पानी को निकलवाने के लिए कभी हमें हफ्ते के लिए हॉस्पिटल में एडमिट होना पड़ता था। 3-4 बार मेट्रो में गए, वहाँ वो दाखिल कर लेते थे और उसका टेम्परेरी एक रिलीफ इनको मिल जाता था, फिर हम वापस आ जाते थे।
I was always fascinated by heart failure. You know, heart muscle disease causing problem has been with us for many years. In early 90s, when you used to treat heart failure, we could only offer these patients symptomatic relief. You know, these people will come with congestive heart failure, with swelling of feet, puffiness of face, and significant breathing problem. But we would prescribe only decongestive treatment to take care of their symptoms. You know, diuretics, digoxin, some vasodilators, so that the symptoms would become better. But unfortunately, we were not able to help them much. And they would keep on coming back to the hospital, getting admitted in the emergency, staying in the CCU for a few days to few weeks, and then this sequence will keep on getting repeated. Fortunately, about 15 years back, some drugs became available which showed us that not only the symptoms could be controlled, but the longevity of these patients could also be prolonged. But this longevity was only for some months to few years, and we were looking for a device or some sort of a treatment which could offer a more permanent solution to this problem.